everyone. Welcome back to another episode of Heart to Heart. As you all know, this is a series on IGTV and now on YouTube that my co-host, Dr. Ambreen Mohammed, and myself, Dr. Amisha Gupta, started to really talk to today's physicians about their journeys through medicine. Today, we are thrilled to have my colleague and friend, Dr. David Werho. Dr. Werho is triple board certified, having completed training in pediatrics, pediatric cardiology, and pediatric intensive care. He now practices as a cardiac intensivist in the CTICU. He is an assistant professor at UC San Diego, associate program director for the fellowship program for pediatric cardiology, has previously been an early career blogger for the American Heart Association, and is well known for his diversity, his activity, and his advocacy in national committees such as PC4, also known as Pediatric Cardiac Critical Care Consortium, and the PCICS Society, which he is even an executive producer for their podcast. So David, welcome, and thank you so much for being on our series today.
Thank you both for having me.
So just to get started, we like to ask everybody the initial question of what got you into medicine? What really got you into pediatric cardiology and pediatric intensive care?
Sure. So actually in college, I was pre-vet. So I was going to go to veterinary school. And then one day I was a stable boy and I got kicked by a horse, and I realized that people kick a lot less harder than horses. So I sort of changed my course at the last minute and went into medicine instead, because obviously the physiological concepts and everything are very similar, but obviously you can do a lot of things with people that you can't do with animals, such as talk to them and form lasting relationships and watch them grow and develop over time, which also sort of lended itself well to going into pediatrics and then ultimately pediatric cardiology.
And what got you interested in intensive care?
So I just love physiology and seeing physiology in action. And I tell trainees this all the time, that the pediatric cardiac intensive care unit is really like probably the place in a children's hospital where you see physiology in action more than anywhere else, except maybe in the cath lab or in the operating room. So even more so than general pediatric critical care, obviously there's a lot of physiology as well. But when you have patients with critical heart disease, any perturbations, even like 5 cc's too much of fluid, can actually make a huge difference. And so really understanding those core physiological concepts and seeing them in action is kind of what guided me towards pediatric cardiac critical care. I think the other thing is that I am not an outpatient person. I cannot do clinic, and but I still want to see my patients grow and develop over time. And I think pediatric cardiac critical care is one of those unique fields where you have patients who come into the hospital frequently and repeatedly often, especially the single ventricle cohort who have multiple surgeries that are sort of planned over the course of their early life. And so you do get to see them grow and develop and eventually come back when they're well just to say hi and run around and that kind of stuff. So it's kind of the best of both worlds, the best of pediatric cardiology, also the best of pediatric critical care.
Yep, and I just have to put in a plug that, our cardiac intensivists are some of the smartest people in the hospital. So good job, team.
As an adult cardiologist, I have a lot of respect for both of you guys, but especially in the critical care realm. I mean, I know, I've done plenty of rounding in the, cardiac intensive care, and I love, CCU medicine, but it's so funny. Anytime you give an adult cardiologist anything to do with congenital cardiology, literally our heads explode. Like you actually see smoke and fire coming out. Like I remember I was studying for echo boards, and I was like, our whole entire class was like, I don't know if we're going to survive if like there's going to be a good amount of congenital, because we're not exposed, to any of that stuff. So seriously, kudos to you guys, because that's, it's very complex stuff. And like, I totally agree. You're dealing with some of the sickest patients and most complex patients in the hospital. So that's amazing. So, Amisha had stated a little bit before that you're very, you advocate for a lot of diversity and inclusion, and you've done that in the past. And so, you know, as I'm sure you know, especially over this past year, 2020, and, you know, in the realm of medicine and a lot of the specialties, including cardiology, that are very, you know, it's known to be very male dominated and not diverse in terms of people of color and women. What changes do you think we need to make moving forward in order to further diversify the field with, like I said, not only women, but also people of color, and not only in adult cardiology, but also in pediatric cardiology?
Sure. I mean, it is a very important issue, and obviously it's a hot button topic at this point in time, which is great. I think one of the things that's very different in pediatric cardiology versus adult cardiology is the gender diversity is a little bit more balanced in pediatrics. And obviously, like in my residency class, I was, you know, one of a minority of male residents because a lot of pediatricians are females. However, despite the majority of pediatricians being female, in pediatric cardiology, it's actually about close to a 50-50 split, which I think is still absolutely fantastic, but it is not representative of, you know, all pediatricians. So I think obviously with time, I think that's going to continue to grow. I think if you look at the workforce and the training numbers, the number of female trainees who go into pediatrics and then subsequently go into pediatric cardiology is increasing. So I think that's great. I think probably the adult world is a little bit different because internal medicine is a heavily male, a majority male dominated field. And so I think sort of related to that, cardiology in adults is also going to be heavily male dominated.